Welcome back. A new groundbreaking advancement at HCA JFK Hospital in West Palm Beach. They're using the X-ray vision for spine surgery, and here to tell us what that means, what it is Dr. William Aaron Gunkel with the hospital. Thanks so much for being here with us. Nice to meet you. So JFK North, you're the first to have this technology. Kind of walk us through what exactly it is and how it works.
Great. Well, thanks so much for the question. Thanks for having us here. So X-Vision is a augmented reality system that we're able to use in spine surgery. And we're the first in Palm Beach County to offer this technology, which is really incredible. So what it does is when we go into surgery, spine surgery is a very precise surgery. And as a result, we need millimeter accuracy in order to adequately place our pedicle screws and instrumentation into the spine. With the augmented reality and X-Vision here, we can get a specialized scan of the patient intraoperatively so that we can see and plan out our procedure before even making incisions.
So we're looking at some video right now of the device. So this you wear on your head.
Correct. So we get that specialized scan. We put the device on our head here. As you can see, we get those images projected onto my retina. And as a result, I can then use those images to place the pedicle screws utilizing various instrumentation. We can place these screws with sub-millimeter accuracy because we all know the last thing we want is redo spine surgeries. We want to get it right the first time. And this technology allows us to do that very precisely.
Dr. Gunkel, what does this mean for the future of spine surgery?
So great question. So when we look at spine, there's numerous navigation systems, and they've kind of really evolved over time. There's been the traditional stealth navigation, there's been other types of robotic navigation, and now it's evolved into augmented reality. What this does is it allows us to have both haptic and auditory feedback, meaning that we get feeling as well as sound feedback. And I like to equate this to GPS driving. When we're driving down the road and we're looking at where we're going to go, our GPS is off the screen. And so we have to look down, look away. That's what traditional navigation systems have done. This system, I can now look at the patient as well as my GPS or augmented reality roadmap on where I want to go when I'm doing my spine surgery. And as a result, my line of sight is not interrupted and I can do a safer procedure and more efficient and quicker procedure for the patients.
That is absolutely incredible. So what type of spine conditions are we talking about here?
Sure. So this system can be used anywhere from the cervical, thoracic, or lumbar spine. These are mainly used in fusion procedures where we're putting screws and rods into the spine to either stabilize slip discs or if someone has a revision surgery or scoliosis or deformity. Any of those type of procedures this can be used for, and they can be used from the most straightforward to all the way to the most complex deformity surgeries where there's different angulations, varying deformities that require a very specialized technique to get the screws in.
Very fascinating, Dr. Gunkel. Thank you so much for being here with us today and telling us about this new technology. If you would like more information, you can head to our website, WPBF.com.